Welcome to another episode of Figuring Out Fertility. My name is Carolyn Dubé. I'm the Executive Director at Fertility Matters Canada, and we are very pleased to be with you for this special Canadian Infertility Awareness session presented by Ferring Pharmaceuticals. This afternoon, we are so happy to be with Dr. Ingrid Lai from Generation Fertility in Toronto, and we're going to talk all things ovulation. This is something that we certainly get a lot of questions, and we see a lot of comments and questions happening in our online support groups. So we're here to sort of learn what we need to learn to sort of debunk some myths and learn how to know when we're ovulating, what to look for directly from a fertility expert. Dr. Lai, thank you so much for being here. I'd love for you to tell everybody a little bit about yourself.
Thank you so much for inviting me to do this talk with you today. So again, I'm Dr. Ingrid Lai. I did my initial obstetrics and gynecology training at the University of Toronto. I also have a master's from there. And then after that, I did my fellowship in fertility at McMaster University. And so after that, I joined Generation Fertility, and I've been here ever since.
Well, we're thrilled. Thank you so much for your time. So why don't we start right back at the basics? What is ovulation?
Right. That's a great question. And we get this question all the time. So ovulation is really the process of the egg being released from the follicle. The follicle is the sac that actually houses that egg and where that egg grows and matures over time within your menstrual cycle. So even to take it back a little bit more, a normal menstrual cycle is anywhere from 24 days to 38 days. And while most women kind of fall within a time frame of plus or minus 1 or 2 days within their average, it is highly unpredictable every cycle, right? Nobody really truly has like a 28-day or 30-day cycle exactly, unless it was being manipulated with medications, for example. In a natural cycle, what usually happens is that ovulation, this process of that release of the egg, occurs about 14 days before the next period. So for example, in someone who has a 28-day cycle, you would end up ovulating around day 14 or so. So that's helpful to know if you can track your cycles and you have a very regular cycle. Less helpful if you don't have a regular cycle. So the key thing to note is whether you do have a regular cycle, and if you don't, that's something that you should be speaking to one of the doctors about, right? Now,
So
typically, yeah, go
I
ahead.
was just going to ask, so if someone has not a 28-day cycle, does the ovulation happen 14 days before the onset of your period, or is it right smack dab in the middle of that time frame?
Yeah, great question. It's the former, actually. So it's not actually mid-cycle.
Okay.
It's 14 days from the next anticipated menses, so which is your period, right?
Okay. Great.
So
Thank you for
for
that.
example, if it's a 24-day cycle, which can still be a normal length of a menstrual cycle, the ovulation is predicted to be around day 10 instead.
Okay. Very helpful. I think that that's a piece of information that may be
Mhm.
misunderstood.
Yes, yes. And that's why it's good to talk about what that normal range actually is, because it is so variable, but can still be normal depending on your specific cycle. Yeah. Now, ovulation, when it occurs, it usually happens after a rise in a hormone called luteinizing hormone. So the short form is LH. So when we see that the LH goes up, then that's when we know that ovulation naturally will occur about 36 to 40 hours later.
Great. So, how can one tell? Is there a way for us to tell when we ovulate?
So there's actually a couple of different ways that we can track for ovulation. Some of the ones you can actually do at home. So one of the simple kind of at-home things that you can do to see if you're ovulating normally is to track your basal body temperature, or BBT. And so the way that that's done is that you would track your temperature every morning as soon as you wake up, and an increase in that temperature indicates that ovulation has occurred. So the increase in that temperature is only by like less than 0.5 degrees Celsius, but it is an indication that if it's holding steady at that increase over the course of several days, let's say 3 to 5 days or so, then that's an indication that your body has released that egg, ovulation has occurred. The only thing about that is that it doesn't help with timing of intercourse or planning for uh, the best fertile window, because by the time that the basal body temperature increases, your body has actually already ovulated, which means that that window is already closed at that point. Now, some of the other ways that you can do it that might be helpful for you to predict the time for intercourse is to use home ovulation prediction kits. And these kits are based on the urine sample. And what it's doing is also detecting the LH levels, but in the urine. And when the urine level goes up, then that's again an indication that the blood levels of the LH have also gone up, and an indication that ovulation might be occurring soon.
Right. And
When
so if you get a increase or a detection of the LH on the home
Mhm,
kit, does that mean you are currently ovulating, or when would you
mhm.
know when to predict
Yeah,
that ovulation
yeah.
timing?
So, I mean, the difficulty is that the kits can only detect a certain level of the LH, and each kit is a little bit different in how it detects it and also how it reports it to you. So, there will be specific instructions for each kit to tell you, well, when it reaches this level, that's when you're starting to have your LH surge or at the peak of your LH surge. So, the difference between the start of the surge and the peak of the surge makes a difference in terms of timing for ovulation, right? So most of the time, the kits are testing when you're at some point between the start of the surge and the peak. So anytime that you get a positive, usually that's the best day to start trying.
Great. Thank you for that.
Mm. Now, when we are looking at more accurate testing, so these now become not at-home tests. These are tests that would involve a lab or a doctor. These would include blood tests as well as a transvaginal ultrasound. So the blood test is, again, detecting LH, but now it's doing so in the bloodstream. And when we test it in the bloodstream, it is much more accurate because, again, the levels of the LH are much more easily detected in blood, and it peaks a little bit later in the urine than it does in the blood. So it starts in the blood first. And again, once we're seeing that the LH is starting to rise, then it gets to its peak. Then shortly after that is when ovulation will occur. We also look at the progesterone levels in addition to the LH, because after ovulation occurs, the progesterone should be increasing. And that's again an indication that it indeed did release that egg. Transvaginal ultrasound is the other way that we track how the follicles grow. And as those follicles grow, there usually is a threshold size that the follicle will get to that we can say likely the egg is about to be released soon because it looks like it's mature. We correlate that with estrogen levels as those follicles grow. And once we can see that it's gotten to the right size, and if we are checking again afterwards, we'll see that that dominant follicle, the one that is the most mature, the one that usually is the one that ovulates, then we see that that shrinks in size because after it's released the egg, all that fluid that was initially in that follicle also is released along with that egg.
Great. So this is important information, obviously, for anyone who's trying to conceive on their own at home. Is this something that would be measured if someone was going through an active fertility treatment or gearing up for an active fertility treatment cycle?
Mhm. So we absolutely use blood tests and transvaginal ultrasound all the time as part of what we call cycle monitoring. And that's exactly what the name suggests, is that we're monitoring the cycle as you go through the cycle. Because the beginning of the cycle, the hormone levels and the follicles look quite different than mid-cycle. So it's still in that follicular phase, which is the first part of the menstrual cycle. And then as you get into closer to the time of ovulation, those hormone levels will all look different. The follicles should look different. And after ovulation, then it gets into the second phase of the menstrual cycle, which is called the luteal phase. And that's a nod to that luteinizing hormone as well, and that process that has happened. So certainly we do all of these tests, and it's important for us to understand what's happening in the cycle because, as we mentioned before, cycles, even if they're regular, can be quite different from person to person. So it's would be much easier for us to understand what would be the recommendations for any specific person if we knew what was happening in their natural cycle.
Right. Now, how do you tell, or is there a way to tell, or when should you be concerned that your cycle isn't your ovulation cycle isn't normal, or is that something we should be concerned about?
Mhm. So generally speaking, the time that we recommend seeing a fertility specialist, or at least speaking to your doctor, either a family doctor or a gynecologist, is if you ever have any concerns about your menstrual cycle, whether it's irregular or the flow has changed drastically, either heavier or lighter, if there's other issues with things like thyroid conditions, other reasons that might affect your menstrual cycle, I would recommend that you speak to a doctor sooner rather than later. You don't have to wait a specific amount of time. If your menstrual cycle has really changed and the hope is for you to get pregnant, then obviously the irregular cycles really do negatively impact your chance of conceiving. And so speaking to a doctor sooner would be the recommendation. If we were talking about a regular menstrual cycle and if the woman is under the age of 35, we would recommend speaking to a fertility specialist after 1 year of trying. Whereas if someone is 35 and over, we would recommend to speak to a fertility specialist after 4 to 6 months of trying.
Now, also probably good information for someone who is not actively trying, may not even have a partner that they'd like to start a family with. Um, for anyone with a uterus and ovaries, this is important information for them to just consider as a young person, to know this information. Could you catch something earlier in your life um, that you can deal with while young
Mhm.
versus figuring out when you're trying to actively get pregnant?
Yeah. And that's really good information for all females, like anybody who has, as you said, uterus, ovaries, tubes, to understand whether or not they're thinking about or planning or currently trying for conception now. Menstrual cycles can, if they fall out of that range of that 24 to 38 days, it can really pose, or it can be an indication that there may be other underlying issues going on. One of the more common things that we see, or common conditions that we see, is called PCOS, so polycystic ovarian syndrome. And that is a condition where there's a higher proportion of the hormones called androgens. And androgens are the hormones that tend to be in higher proportion in males, but actually all males and females, like anyone who has ovaries and anyone who has testicles, will have these types of hormones, as I said, in different proportions. But PCOS is one of the most common causes of issues with ovulation. So this is what we would call anovulation, meaning that ovulation or release of that egg doesn't happen at all. And it can also cause significant cycle irregularities. So if this is something that can be caught much earlier or diagnosed much earlier, then it can have implications for other parts of your health. So sometimes we diagnose this in teenagers, or those who have just started to get their first periods and have either very irregular cycles or very heavy flow. And so we start looking for reasons like PCOS that could contribute to other parts of your life. And so some of these things include, for example, understanding whether the lining of the uterus has become thick and there's no period, in which case we would be concerned about that thickness or the changes in those cells occurring to something more dangerous. We would also be concerned about things like risk of diabetes or metabolic syndrome, which are tend to be in higher proportions in women who have PCOS. But also it's very important for heart health. So cardiovascular health is also can be very compromised if we don't know about this diagnosis, or the people who have this diagnosis don't understand what other health implications there may be aside from just the reproductive piece.
Oh, that's really helpful information. And I think um, something that, again, not necessarily the conversations that are happening in the younger population with their family physicians, for example, might not be part of a general checkup. So I think that that's really important information for women and people with uteruses and ovaries and tubes to
Mhm,
have that information to sort of take their reproductive health into their own hands.
mhm,
Great. Um, how does your cycle affect the chances of conception?
mhm. So having a regular cycle is the best situation for trying on your own for pregnancy. And that's because there's predictability there. Very likely, especially if you're using those tests that we talked about before, if ovulation is occurring, it tends to happen in a regular cycle, whatever the length of that cycle is. But once we get into cycle irregularities, that predictability is gone, right? And so it does negatively impact your chances of conceiving because there isn't a way to accurately track if you're ovulating, when you're ovulating, and because the egg only, after it's released, it only survives 12 to 24 hours, whereas
Oh,
sperm can live up to 5 days, typically somewhere around 3 to 5 days. That window is really dependent on what the egg is doing and where it's at. So understanding where in your cycle ovulation is happening, and if, of course, if it is happening, those are very important to try to maximize your chances of natural conception.
okay, that's great. Do you find that when people come to, when you see patients, that that's something that I'm just curious to know if that's something that comes as a surprise to a lot of people, or do some people have this information and not have the information? I'm just curious to know from a general population education
Mhm. Yeah.
perspective.
I mean, I think it's so individualized, and
Mhm.
that's why it's important to speak to a fertility specialist if you do really have concerns or have been trying for a while, because these are things that we can talk to you about, but specific to your particular situation. I
Mhm.
think, for the people who already know a lot about how irregular cycles can affect their ability to conceive, they've already spoken to their family doctor or a gynecologist who maybe already even gave them a diagnosis of something like an ovulatory issue like PCOS. For the people who have never seen a doctor about this, or maybe weren't wanting to discuss this with anybody else, then I do find that it is very new information, and understanding that, well, with an irregular cycle, uh, there are less opportunities over the same time frame to even try to conceive. So if you can imagine, if someone is having a 28-day cycle or 30-day cycle, that's about 10 to 12 opportunities to try in a year. Whereas for someone with an irregular cycle every 3 months or 4 months, that's a lot less opportunities to even try for that egg to be fertilized. So I think this is new information for some, and something that we're really reviewing with others.
Great. Um, is it possible to have a regular or more regular cycle and not ovulate?
Yes, it is, unfortunately. So this again happens typically with women who have PCOS, but sometimes can happen outside of that as well. And that, because the ovulation depends on so many different things. So it depends on the response of the ovaries towards those hormones. It depends on the fluctuation of those hormones throughout the cycle, and it has to fluctuate in a sort of predictable manner with estrogen, progesterone, luteinizing hormone, which is that LH, and then the follicle stimulating hormone, which is FSH. All of those have a fine balance. And so if anything is off, then those things can be off. Now, the period, though, is not to necessarily directly linked to the ovary. It is a response to what the hormone levels are doing. So the period is actually shedding of that lining, that inner lining of the uterus, which is called the endometrium. And so that can happen even if the follicle is not actually releasing an egg at the appropriate time or at a mature level. So the short answer is yes, unfortunately, it can happen. And the long answer is there are lots of different factors that can really affect that. But this is why if you have concerns, speak to your doctor, speak to a fertility specialist, and then we can do further tests to determine if this is truly what is happening for you.
Really, really good information. And again, just normalizing these conversations and allowing people to have a better understanding of things that they could or should be looking for, and questions maybe that they could ask and feel comfortable asking their physicians.
Mhm. Mhm. So
Great.
I'll just end off with so the fertile window is something that is elusive to many.
Hmm.
And what we do know is that the time right before ovulation, so that 6 days before and including ovulation, that's really the most fertile time.
Okay.
Once ovulation has occurred and that egg has been released, it's picked up by the tube, there really is a very much shorter window, that 24-hour period for conception to occur. So if you're trying to optimize your chances for natural conception, the advice is always to try in those days before your predicted ovulation, with the highest chance of pregnancy being the day right before you ovulate.
Okay, great. Because the sperm is still able to live.
Yes,
Yes,
exactly. You've got it.
great. Um, I think those were all of the questions that we had that we had to come in closing, is there anything that we have not touched on that you think is really important information, or that patients or those looking for information should have?
Hmm. And I think it's a very important point that you talked about normalizing these types of
Mm.
conversations, because while this happens so often, right? A lot of people have cycles that are regular, and the cycles happen almost every month for most. It is not something that we talk about a lot, and it's hard to understand whether your cycle is truly normal, or is that normal for you,
Right.
and is it something that you need to be concerned about. And I think these are not questions that are easy to answer at home, and it's not easy to figure out at home. Some of the testing that I talked about before are ways that you can try to check on your own, but if you have ever any concerns, I do recommend talking to a doctor sooner rather than later. And if your family doctor or your gynecologist recommends that you speak to a fertility specialist sooner, we're always happy to do fertility assessments, even if you're not quite ready to get into an actual conception or into anything like a fertility treatment. We're happy to talk to you about what this means and how we can help you.
Yeah, and I agree with looking at it doesn't mean these fertility sort of I forget the term you used,
Assessments, yeah.
assessment.
Mhm.
Thank you. Doesn't have to happen because you're actively trying to start a family or have a baby. These are things that you can have conversations about so that you can plan
Yes.
your life to give you peace of
Mhm.
mind. If something comes up, then at least maybe you're dealing with an issue now versus
Mhm.
5 years from now, and things
Mhm.
can potentially go a little bit smoother when you're ready to start your family.
Yes, exactly. Which
Wonderful.
is power, right?
Well, this was lovely, Dr. Lai. Thank you so much for this information. I uh, always feel like I knew a bit more about ovulation, but there were a few things that you mentioned today that were very good for me to hear and to learn. So thank you for your time and your information. If people want to get in touch with you, how would they find you?
So you can find me at generationfertility.ca. And there we have a lot of information for patients. We have ways to reach us and contact us. You'll see the other doctors that are there too. So please feel free, Google us. We are available and ready to support you.
And very active on social media as well. So if
Yes,
that's your
Jen. Yes.
preferred way, Generation Fertility on Instagram for sure.
Yes.
Very active. Well, thank you all for tuning into this episode of Figuring Out Fertility. We hope that you are enjoying Canadian Infertility Awareness Week 2022, and that the sessions and the information you have been watching are truly helping you find the joy, the small moments of joy and hope along your fertility journey. Sometimes that can be very heavy. So we appreciate everybody for being here. And for more information on the events, visit ciw.ca. And a huge thanks to our presenting sponsor, Ferring Pharmaceuticals, for your generous contributions to our event. Thank you so much, everyone.